Hello, my name is Dr. Abraham Halleck. I'm an internal medicine resident at MedStar Health in Baltimore, and I'll be presenting our case at the American Thyroid Association conference. Our case is thyroid regrowth after total thyroidectomy and Graves' hyperthyroidism. And to introduce our case, total thyroidectomy is a treatment option for Graves' disease with compressive neck symptoms, large goiters, or personal patient's preference. Randomized studies have shown the risk of Graves' disease relapse in surgically treated adults ranges from 3 to 8%. The thyroid gland is considered a non-regenerative organ, and regrowth from stimulation by TSH is rarely significant to cause a meaningful effect. Furthermore, when total thyroidectomy for goiter is performed, the estimated recurrence rate for thyroid regrowth is roughly 0 to 0.3%, so it's fairly uncommon. Therefore, we're going to present a case of a patient with Graves' disease who was treated with a total thyroidectomy and was found to have regrowth of thyroid tissue that did not require long-term thyroid hormone replacement therapy. Our case begins with a 56-year-old man who has Graves' disease. He underwent a total thyroidectomy for compressive neck symptoms. He initially was started on thyroid hormone replacement therapy for post-surgical hypothyroidism. A year later, he required frequent decreasing dose adjustments of the levothyroxine until therapy was discontinued altogether, as his TSH was consistently suppressed. On presentation to our clinic, he reported feeling well without hypothyroid symptoms. His laboratory findings off of the thyroid hormone replacement therapy revealed a TSH of 1.43 and a free T4 of 1.23. An ultrasound was done, which revealed thyroid tissue despite his previous total thyroidectomy. And in figure 1, you can see this is the transverse view of the right thyroid lobe. Thyroid tissue is indicated by the yellow arrow. And in figure 2, this is also the transverse view but of the left thyroid lobe, and the thyroid tissue is indicated by the yellow arrow as well. So to discuss this case, it highlights the importance of further investigation after total thyroidectomy for Graves' disease in the setting of suppressed TSH levels. Although the possibility of Graves' disease recurrence exists, the risk of relapse after surgery is low. It's pivotal to consider an alternative explanation, such as excessive supplementation with thyroid hormone replacement therapy, thyroid regrowth, ectopic thyroid tissue, or presence of a remnant, which could be a possibility in our patient. Additional workup, such as a TSI, TRAB, or thyroid uptake scans may be required to further characterize the etiology. We did obtain a TSI, which was elevated at 3.56. Our patient did not receive iodine before or after surgery, and recurrences can be explained based on thyroid gland embryologic descent. Thyroid rests can be present in over 50% of patients and may be mistaken for lymph nodes or parathyroid glands, which is another possibility in this patient's case. Animal studies have shown a possible alteration of C cells and follicular cells after partial thyroidectomy becoming immature cells and possibly participating in repair or regeneration of the thyroid gland. And our case, 1 year after surgery, our patient was euthyroid with evidence of thyroid regrowth, not on any thyroid medication, whether it be methimazole or levothyroxine. These are our references below. Thank you so much for listening, and this concludes our case presentation.